Dr. Miller, you had mentioned the late 19th century, the 1890s or 80s, that it was believed that breast cancer was caused by infection, and now there's some evidence that maybe bacteria plays a role in the development of cancers. I'm wondering, I'm sort of presuming that the incidence of breast cancer increased since that period of time, and I'm wondering if that increase coincided with the development of antibiotics.
Well, that's a terrific question. I want to circle back for 1 second. I want to compliment you on saying hologenome correctly. You're about the only person ever to get that word right. You're terrific.
How do people pronounce it? Hologenome?
I don't even want to go into it. All I'm saying is you are
good. Thank
terrific
you.
at it. Anyway, it's a terrific question, and the answer is yes, there is an increasing incidence of breast cancer over time, but you have to be really, really careful. We want to talk about good science here and not fly off to improper conclusions. Okay. So what do I mean by that? Well, cancer increases as you age, and we're very fortunate to live in an era in which life expectancy is improving. Mm-hmm. So there would be a tendency for a disease that tends to increase with age to have a higher incidence as the population ages.
Right.
But there are things that go beyond that, though, that are really interesting and pertinent. One, for example, is an association between diet and breast cancer. We've known for a long time that cultures with a differing diet, and of course there are different ethnicities also, so take the Japanese population, mm-hmm. much lower incidence of breast cancer. The Chinese population, a lower incidence of breast cancer. So it's difficult to tease out the exact reasons. Is it diet or is it ethnicity? But the reason why diet could be important is now that we've learned that we're these ecologies, and the gut ecology is super, super important, we also know that the balance of the ecologies in one spot is infected by another. Mm. So what I'm getting at is that a change in the diet, although this seems unlikely, can actually have an influence on the outcome of the likelihood of inflammatory changes in the breast that could lead to the development of breast cancer. Now, asking about antibiotics in particular, there are some papers that indicate, so there's research that does suggest that the administration of antibiotics changes the balance that I'm talking about, and that a history of the frequent or abundant use of antibiotics, which some people have to do to maintain their health, mm-hmm. is associated with a higher incidence of breast cancer. Mm. These are tough things to tease out and have absolute clarity, but at the moment there does seem to be some association between